Welcome back to the Hunt Harvest Health Podcast. I am Dr. Hillary Lampers. Really excited to have you on here. If you are viewing this on YouTube, you will see that I'm trying to get better at YouTube. If you're listening on audio, make sure you go over, subscribe, and follow us on YouTube as well. You can also watch this video. I recently did a men's health series, which is a 5-part series. I unfortunately did not record that for YouTube, so there's no video on that, but we do have the audio over at stealthyhunter.com. You can see our podcast links there. You can also go to any of your podcast platforms like Apple Podcasts or Spotify, etc., to find those series that I did in November. I got a ton of feedback on that series, and so I decided what I wanted to do was start doing more of these health series. I like the 5 parts just because there's 5 days in a week, and most of you are commuting to work, out there on the road, or you only have a little bit of time to listen to each podcast. And so I think the 5-part series works well. Of course, on any of these topics that we talk about, you could talk forever. There's way more than 5 days or 5 hours related to each topic. So as I work at building more of these health series, we will kind of fill in the blanks here and there. Now, if you don't already know me, I'm sure most of you, if you're listening to this, you know me, and you're probably sick of hearing my voice, just like I am most days. But just a little bit of an introduction about myself. I'm a naturopathic physician. I practice in Bozeman, Montana currently. I have been a naturopathic physician for about 18 years now. First 13 years of that, I practiced north of Seattle, Washington, in Snohomish, Washington, where I met my husband, Ryan. He is also the co-host of this podcast with me. Sometimes he's on here and we talk about things like health, carnivore diet, his newfound hobby of goats. In the past, we've talked about gardening, lifestyle, sustainability, family, adventures, relationship, and of course, hunting. If you're new to this podcast as well, and you're not a hunter, that's fine. There's lots of information on here related to just more sustainable ways of living. You don't have to be a hunter. But if you tune into the podcast with my husband, traditionally, he's talking about hunting because that is really his great love. We also encourage that if you are a hunter or a new hunter and you enjoy watching films, that you watch our films here at the Stealthy Hunter channel. We have a few films that we've put out with our daughters, which are very good. And Ryan is currently working on new films for the channel, which is very exciting. You can also go over to Gritty Films. Ryan has dozens of films that he's done with Brian Call, who is the creator of Gritty, or Gritty Bowman as he used to be known. And they are hunting buddies, really. And they have made some fabulous films together. So we highly encourage that you go over there and you can watch those films. Anything that I talk about, especially, I'm going to be talking mostly about health, and that's because that's my world. I am actually not a hunter, and I'm sure most of you who listen to this know that. I have been hunting with my daughter, especially when she got her first mule deer, her second mule deer. I have been hunting with my husband a few times, but I have never actually taken an animal, and that is just a personal decision that I've made. Now, if I had to, I would hunt. My husband does a lot. He's adventuring all the time, and we have plenty of meat. Therefore, I don't feel like I need to take an animal's life. It's just not my calling. But if I needed to, and I guess never say never, you never know. But just so that you know, I am not a hunter. However, I do highly advocate for this community. And the reason for that is just to go back on my story a little bit and give you a little background on how I got into this community, how Ryan and I got here, and why I've come to love it so much. So about almost 10 years ago, Ryan and I have been married for almost 30 years, if you can believe it. We got married quite young, and we've been together a long time. But really, for about the first 15 or more years of our marriage, I was not a supportive wife when it came to hunting. I felt that there were a lot of emotional, complex issues related to it. I also grew up in a family that did not advocate for hunting, and a lot of the information that I got about hunting was very negative. And unfortunately, I think when I married Ryan, these were not discussions that we had. We didn't really talk about whether or not this was going to be something that we were going to um, have to manage in the future, especially when we had children. But as we got older, we started having more problems with me not being supportive and him leaving all the time and wanting to do this. And I've done tons of podcasts out there related to relationships in this community, with women feeling like they're neglected at home with the children while their husbands are out adventuring, living their life. And I will say it has been a difficult process for me over the decades to come to the place I am. So I don't want to fool anybody and let you think that this is something that came very easy to me, because it didn't. Now, I know lots of women in the industry who were hunters, are hunters, they married hunters, and it's a very different scenario. But I will say, even for those women, especially after they have children, there can be a lot of relationship issues related to this, because they may not get to go out hunting as much as they used to, and they feel like they've lost some of their freedom. Now, I do have some amazing girlfriends who they have babies and they're taking them out in the great outdoors with them and they're doing stuff. So I guess there's really no excuse. Excuses are like, what do they say? I don't know. I mean, excuses are excuses. And so there are women that do it, but I do know that in relationships it can be difficult. So in my situation, Ryan and I really had very different lives. He worked in the outdoor industry for many years in a family business. I was in the healthcare industry, and as we kind of joke, we didn't really have much of the same interests, except for our garden and our children. Now, when we were young, we loved to do the outdoors, and we did skiing, backcountry skiing, rock climbing, hiking. I mean, you name it, we were doing that. But I was not going hunting, and that was another love of his. I would go fishing, but just not hunting. And then our kids came into the picture, and some of that changed. My older daughter now is an avid hunter. She absolutely loves being with her father, and she's learned a lot from that. And I think it's given her a lot of very valuable life skills. We have a second daughter. I don't know. She's not as quite inclined to it as her older sister, but we'll see. Everybody has their different temperament, and I think that's what we've learned in this process. That's normal. And so Ryan and I started this podcast in 2016 after we had been in some trained hunt events, where I had gone with Ryan to these kind of like Spartan races for hunters. And I had gotten exposed to like a really amazing community of people. And I started thinking, oh, wow, maybe this isn't such a horrible, sadistic bunch of murderers. And so from there, we decided to start the podcast together, and we just wanted to talk about things like health. At that time, Ryan was a big gardener, and we had a garden, grew food. We had I call it a little small cottage farm. And this was really in the late, it's like 2016, when the homesteading movement and everything was really starting to pick up. And that's when we started this podcast. And then in 2018, we decided to make a huge life change and move to Montana, which was a very large decision for us. We were leaving family in Washington and my family, I'm originally from Montana, so we came here. And it was a very difficult, and it took years for us to make the decision. And we, of course, did not want to leave our special little place that we had built over 20 years there. But it was time. The rain was too much. The traffic was getting bad. And we are so lucky we moved when we did, because we got here prior to the quarantine and what we all have lived through the last 4 years. But we were able to move to Montana and get affordable housing, which is changing a lot now since the pandemic. And so at that time, I was only working part-time, and I was raising 2 young children. And Ryan was working 20-hour days and was gone a lot. And then we moved here, and I decided to go back to work more full-time. in healthcare. And Bozeman got very busy after the pandemic. Lots of people moved here. And so our health clinic got very busy as well. But it's been a lot, and it's been a huge juggle to manage, a home, a busy job, and then our little business, Stealthy Hunter, and this podcast, Hunt Harvest Health, has turned into a larger product business. And we are now a really focused nutritional product company with supplements. And through this podcast, I am really hoping to educate you all out there. Now, the hunting community is really a small community. I think the statistics are about 8 to 10% of the population hunts. And there's a big group of people in the middle that are kind of like on the, they're not for it, they're not against it, they don't really know. We have seen a resurgence after the pandemic of people coming over and wanting to learn how to be more self-sufficient and provide their own meat. So that's been really cool. And I really just feel that I wanted to help this community more because I wasn't seeing a whole lot of healthcare directed at you guys and gals. I wasn't seeing doctors really talking with you and to you, but a lot of healthcare, as we know, is really talking down to people and not giving you per se the best information to make more strategic decisions for your health and for your family's health. And personally, what we have watched over the last 4 years is much to be dismayed, and the healthcare industry has lost a lot of people's trust. So as a naturopathic physician, I feel that I have always been swimming upstream. Naturopathic physicians are not licensed in every state. Luckily, I have lived in states that have great licensing and we have great scopes of practice. But, we are not licensed like MDs. And so we are not hospitalists. We do not do surgery. I mean, there are some people that do minor surgery, but nobody's really working in a hospital. And we are more focused on root cause care and not symptom care. Naturopaths, this is an old profession. Our profession comes from Europe, and it was the medicine before we had the American Academy of the Medical Professionals. We were using herbs, nutrients, diet, lifestyle, hydrotherapy, sun, light, all these things long before even antibiotics were discovered. Now, there's been a lot of things in healthcare that have really changed our lives. I mean, antibiotics is one. It's saved probably millions, if not billions of lives on this planet based on its ability to kill infection. But as we know, the pendulum can always swing. And so these days we see a lot of antibiotic resistance because we've overused those medications. There are amazing advancements in care, surgical care. Obviously, there's anesthesia now, there's IV bags. I mean, there's so much that can and does save lives every single day. However, what we have lost in the past is this real connection to our own internal healing. And so naturopathic physicians, we are trained as primary care physicians, but we also learn in our scope, we learn about nutrition, diet, movement, relationship. We have counseling, we do some homeopathy. We learn about herbs. We also learn pharmacology and drugs. We learn about hydrotherapy, hot, cold. We would learn about light. We learn about sound therapies. And so we really have a very unique and what I believe to be a very broad-based education that even most MDs don't have. And I think in today's world, we can really work collaboratively with MDs to help patients get better. Now, in my case, I've sort of graduated in my healthcare journey. I started working with a lot of head trauma and TBI. I was working with a lot of headaches and breathing disorders. That's where I started my profession in. And I've graduated into, I still do some of that, but I also do a lot of midlife care for both men and women, doing a lot of andropause, menopause, hormone replacement therapy, PRP and platelet-rich plasma, orthopedic treatments, and massage, etc., that I was trained in almost 30 years ago. So I'm using these modalities in my practice right now. However, I love to talk about the basics, and none of us really get now to the age like middle age. So I'm middle age, I'm in my 50s, and I didn't get here without decades of trials and tribulations and illnesses and childbearing and pregnancy, breastfeeding. I've been through menopause, and so we all go through life stages that, God willing, you're going to go through them. But I think that we take a lot of responsibility away from patients when we don't help to educate them on the things that they could be doing in their daily lives to help them get to the ripe old age of 50 or 60, feeling better and feeling good and being healthy. So that's a little bit of my background, and the hunting community has been very good to us. It has supported our small business. It has watched the films. It has come and seen us at public events. It has listened to this podcast. And you have all sent us amazing, gracious emails and notes. And if we don't respond, please don't take it personally. It is overwhelming, and we feel so very fortunate and blessed that the Creator brought this into our lives when it did, and through that, it's brought all of you to us. And so if this is your first time here, that's just a little bit of background on me. And of course, I'm sure most of you are here because you follow Ryan. So maybe someday I'll have Ryan get on here and do his little bio as well. All right. So we, from the very beginning, I think it was episode number 6, maybe I'm wrong, 5 or 6, Ryan and I talked about gut health. I've also had numerous physicians on in the past talking about the importance of gut health. And this is a topic that never gets old. And the reason it never gets old is because our gut is basically the foundation of our health. Everything we eat, everything we drink, actually everything we think and feel in our body is going to be processed by the gut. And so what I wanted to do in this 5-part series was talk about the different aspects of GI health and how we can improve them. We do have a supplement stack over at stealthynutrition.com. We've had this for years, and this can go along with some of this I'm going to be talking about over the next 5 episodes. This is a supportive bundle that can help you with each one of these areas that I'm going to be talking with, and that's the gut restoration bundle. And I'll be talking about each one of those products separately that's in the bundle. But if you wanted to start, it's almost January. It's just a couple weeks till January. So if you wanted to start something new in 2025, you can maybe think about doing the gut restoration program, which is free on our website. And I'll also put the link here in the notes so that you can find that. It's a great time after the holidays, etc., just to do a good clearing of the GI tract and to clean up your diet, which is a big piece of what we are going to talk about in the next 5 episodes. All right, so today's episode is really just to scare the living daylights out of you. No, I'm kidding, but really, I'm not. In today's world, GI issues have become absolutely too many to count, really. And in the top cancers, as well as the top autoimmune conditions that we're seeing, and outside of those, one of the main reasons people go to the doctor is because of GI concerns and complaints. So today I wanted to give you some statistics and kind of wind down a little bit into why the gut is important and what's happening in our country right now. If I live in the United States, I'm an American. So if you're listening to this in another country, it may not 100% apply to you. But I wanted to go over some of the statistics related to gut health in the United States, and we are going to do some comparison to the rest of the world, as well as some other things. All right, so let's get started. That's right, I got to put my reading glasses on a little bit here, folks. This is one of the things that does happen as you get older. It's natural, it's normal, but sometimes reading is the thing. So, all right. So what I wanted to do first is just talk about, the top 10 reasons why people commonly visit the doctor. And number one is obviously for general health, health checkups and preventative exams. You go every year for your annual, and this helps possibly reduce the risk of chronic diseases. It supports early intervention. This would be things like your yearly physical, your mammogram, colonoscopy, etc., those kinds of things. Now, the second reason that folks usually go to the doctor too is respiratory issues, like coughs, colds, viruses, asthma, bronchitis. These are really common. Number three would be blood pressure and hypertension. And so this is a huge problem, and I feel like I see it in a lot of people young as well. And really, if it's left untreated, it can cause a lot of problems, included increased risk of heart disease and kidney problems. And remember, heart disease and cardiovascular disease are the number one killer of Americans, both men and women. The next one would be chronic pain. So most of us have had pain in our life, and we understand back pain, neck pain, joint pain. And so degenerative conditions would be a big reason people go to the doctor. Another one is diabetes management. So really, in general, endocrinologists have basically become diabetes managers. And diabetes is so common, but it does have a lot of long-term complications like neuropathies and kidney disease, as well as blindness, etc. And so there is a lot of diabetes management that has to happen when somebody is diagnosed and or that ill in the final stages. Another reason is skin conditions, obviously going to the dermatologist, but acne, eczema, rashes, skin infections, usually too, because these are cosmetic and they can be really hard for people to have. So dermatology is another big reason that people go to the doctor. Mental health concerns. This is very common, and I feel like it's becoming much more common. Anxiety, depression, stress, sleep disorders. And, also I think in today's world, we have a much more increased awareness of mental health and seeking help when we do have it, which is something that in the past generations, there just was not access to these services. But mental health concerns are a big reason that people go to the doctor. Now, here's the big one, and we're going to be talking about this week, and we'll be talking about others that I've listed here because they all go together. Digestive issues. So common conditions here are GERD or acid reflux, constipation, chronic diarrhea, abdominal pain. You could throw diarrhea and constipation into the IBS category. Also IBD, which is irritable bowel disease, Crohn's disease, ulcerative colitis, etc., which we're going to talk more about. The list is very long for digestive complaints. I've only named a few. This is one of the big reasons people go to physicians. Another obviously would be infections, urinary tract infections, strep throat, sexually transmitted diseases, infections that require either viral care and or antibiotic care. This is a big reason why people go to the doctor. And then the last one I'll share is fatigue. Now, fatigue can be a symptom of so many underlying issues, and it's a symptom of things like thyroid disorders, anemia, sleep disorders, sleep apnea, chronic fatigue syndrome, depression, adrenal insufficiency. I mean, you name it, fatigue is on that list. And I would say it's probably one of the number one diagnoses that I give in my practice. And that's probably because I'm dealing with a lot of people with hormone dysfunction, middle-aged people who life is changing and things are changing. So fatigue can be a big symptom there. So these are really the top 10 reasons that people go to the doctor. I think the next thing to look at would be looking at the GI system itself and some statistics related to cancers in the United States. Now, the C word is a big word that scares a lot of people, and I understand that it can be kind of a overwhelming subject when you talk about cancer because there are lots of different cancers, but we're going to talk today about cancers that originate significantly impact the digestive system, making them really lethal in general. First on this list is colorectal cancer. It's the third most common cause of cancer in both men and women, and it's the leading cause of cancer-related deaths in the U.S., which is really intriguing. With an estimated 53,000 deaths expected this year alone in 2024, it's very serious. They have lowered the screening from 50 down to 45 because colon cancer is also very preventable if caught early. So risk factors for colon cancer on the list that you will see is processed meats, obesity, smoking, and alcohol consumption. And then poor diet in general, high processed food diet. And as you know, we're going to talk a little bit more here about diet in this country and processed food. The next cancer would be pancreatic cancer. And this cancer accounts for about 3% of all cancers in the US. So it is not as common as colon cancer, but it is much more deadly, even though colon cancer is number one, probably just numbers related based on how many people get it. When you get pancreatic cancer, usually it's detected very late. And so it's very deadly. About 51,000 deaths are projected for this last year of 2024. And usually due to these vague symptoms, you're going to have about a 5-year survival rate of only 11%. So again, very hard one to get over. And the risk factors, again, include smoking, obesity, chronic pancreatitis, which can come from alcoholism, diabetes, and family history, some types of pancreatic cancer that are genetic. All right, another one is liver and intrahepatic, which means just in the liver, bile duct cancer. And this is really, again, a less common cancer, again, very lethal. And it is the fifth leading cause of cancer-related deaths in men. It's higher in men. And they're expecting about 29,000 deaths this year. Risk factors include if you've had chronic Hep B or hepatitis C infection, alcoholism, non-alcoholic fatty liver disease, which is becoming more and more common in our culture, and obesity. They do recommend that getting vaccinated for Hep B and or treatment for hepatitis C can help prevent this cancer. All right, another cancer that's pretty significant to cancer-related deaths in the United States is stomach cancer, or as we call it, gastric cancer. And there's going to be about 11,000 deaths in 2024 from this. Risk factors include an infection called H. pylori, which is a bacteria that lives in the stomach. And you can be a carrier of it. It's contagious. You can get it from other people. Usually you find this out because you have a history of peptic ulcers. H. pylori can play big into that. Smoking, obesity, and diets high in salted or smoked foods can lead to gastric because the stomach lining is very sensitive to these foods, alcohol, smoking, and excessive salt. And you can get detection for H. pylori, etc. There are also genetic stomach cancers that come from Asia, interestingly enough, and they can influence gastric cancer. And then lastly, we'll talk a little bit about esophageal cancer. And this is rare, but it's very aggressive, and it does have a high mortality rate, again, usually due to late diagnosis. About 16,000 deaths are estimated for 2024. And risk factors for this include previous GERD or acid reflux, a condition called Barrett's esophagus, which is genetic and does run in families, and smoking, alcohol use, and obesity. In addition to these top GI cancers, we have cancers like gallbladder cancer, bile duct cancer, small intestine cancer. There is cancers like peritoneal cancer, which is cancer of the peritoneal tissue. The peritoneum is basically your intestinal sac that all your organs sit in. And you can get cancer that's either spread from other organs into the peritoneum, or you can get peritoneal cancer itself. My grandmother died of peritoneal cancer. It was very aggressive, and from the time of diagnosis to death, it was a little bit over a month. And it was very sad to watch her go through it, very painful. But again, a very rare cancer. And so as you can see, just really with these cancers, I just wanted to give you these statistics because GI cancers are, even though some of these are rare, they are on the rise. And this is something to think about. Now, with all the risk factors that we see here in this list, we heard a little bit about food like processed meats, etc. And alcohol is a big one. If you have GI cancers in your family history, especially colorectal cancer or any of these, like, stop drinking. Really, drinking is not good. Smoking is horrible, as you can see, and obesity. So these are lifestyle factors that are really important, not just to change how you look or to decrease your chance of lung cancer, which is obviously one of the top rated, top cancers we get, but like GI cancer, people don't think about that when they have these lifestyle things. All right, so now let's talk a little bit about food, okay? And food allergies. Now, food allergies are something that we think about when we think of having a reaction, and it can be in any system of the body. The question is, could food be causing this reaction? So we just gave a bunch of statistics about why people go to the doctor. We talked about cancers. We're going to talk about autoimmune disease here in a minute. But one of the big things is our food system and the type of food that we are eating, which I'm going to talk about as well.
So
But the American diet is highly
vomiting,
processed,
diarrhea,
and
abdominal
it has
pain,
been for a number of
cramping.
decades now, and it seems to be getting
Could be
worse.
something like
60% of our diet is processed foods or more. Okay. So when we think about food allergies, we want to think about the food that we're eating and the reaction that we could be having. Now, when we think about GI health and we think about what the GI is doing, we want to think about it as affecting every other system in the body. So your GI is affecting your brain, it's affecting the skin, it's affecting the lungs, it's affecting the liver. I mean, liver is part of the GI tract. It's affecting your metabolic health. It's actually influencing your sex hormones, your thyroid, your adrenals. So all of these things can be intertwined, and the gut is really the foundation of all of this. So food allergies can manifest through a range of symptoms, varying from mild to life-threatening, really. And so here are really some of the top things that we see people coming in when we suspect food allergies. And what I want you to also think about here is these reactions. You may not, when you're coming into the doctor, you may not think you have a food allergy, but just listen to this list of things that people have that they're going to the doctor for in general and see if you think any of these or all of these could be connected to the food that you eat. So the first would be skin reactions. Now, skin reactions can include hives, eczema, swelling. I've seen people come in with swelling under their eyes, swelling in the face. And we know a lot of this as anaphylaxis, right? You eat peanut butter and your throat swells and you could die. So obviously that's very dangerous. But skin itself, so seeing the skin, seeing the redness, seeing the hives, and this is caused by an immune system release of histamine. And in response to the allergen, the body's trying to protect you. So it's producing histamine. And I'll probably do an entire series on histamine because it's become sort of a epidemic of sorts, especially since the pandemic hit us. We can talk more about that. But so skin reactions are a huge one. The other thing I would think about too is acne. I would think about rosacea. I would think about any of these topical skin issues that we see in people, not just swelling and inflammation. All right, number 2 on there obviously is gastrointestinal symptoms. Constipation, any of these kinds of disorders, irritable bowel syndrome, any of these things could be leading to this. Also on that list we talked about earlier, GERD, acid reflux, all that can play into it. And these allergies can be affecting the digestive system, and this is leading to irritation and inflammation. And usually gastritis, like if you've got inflammation in your stomach, it's pretty painful. You know, the abdominal stuff is pretty painful. And when we talk about autoimmune conditions, we'll talk more about these tissues as well. Food allergies can cause respiratory symptoms. So nasal congestion, sneezing, runny nose, coughing, wheezing, difficulty breathing. Again, that tight throat, that histamine reaction can cause respiratory issues. And it can be from something you breathed in. It could be from something you ate, obviously a food allergy. It can be from contact dermatitis, something touching you, which would be the rash, but you can also get the respiratory symptom. And a big one there, besides food, I would say would be toxic contaminants in the air that we're breathing in that can cause these too. Another thing with food allergies, we see a lot of oral allergies. So we can see like tingling or itching in the mouth, the ears, like lots of ear itching, lips or throat. Another one is like anal itching. Now, parasites, I may touch on parasites a little bit in this series, but that can be a sign of parasites as well. Thinking about that. But the oral allergy, back to the oral, is gonna be from foods you eat, maybe like raw food. I get that when I eat kiwi. I get this like weird feeling in my mouth. It feels like my tongue is gonna swell, but it doesn't quite swell. Nuts and tree nuts are kind of culprits on this as well. So oral allergies can be a big sign of allergy. Actually, cardiovascular symptoms, we don't think about this a lot, but dizziness, lightheadedness, fainting, rapid drop in blood pressure, maybe an elevation in blood pressure. And these are from severe allergic reactions that cause blood vessels to dilate. For dilation for the blood pressure to drop, and then also vasoconstriction for hypertension to go up. But this is how the GI tract is connected to everything, right? It's connected to your vascular system, because once you eat that food, it's going to go across the intestinal barrier into the blood system, and immediately it's going to be affecting your tissues, and your vessels can be there as well. So something to think about there. Another one could be eye symptoms, so red, itchy, watery, or swollen eyes. Again, that's the histamine release. And then delayed symptoms. So when we talk about food allergy, a lot of times if you go to an allergist, they test you for IgE. With food allergy, if you were to get tested by us, we also test IgG, and this is a delayed antibody. So you can have symptoms related to ingestion of a food up to 72 hours after you eat it. And so things like, swelling, irritation, headaches, congestion, GI pain, random diarrhea, skin issues, that can kind of play into all these, but they can be delayed. They're not right away. They happen over a course of a couple days. And then the other type of delayed symptom, quote unquote, is like a delay in getting things to move. So this would be like a difficulty swallowing. You're having some kind of allergic reaction, and so the esophagus is swelling and you can't swallow the food. This can food impaction, chronic inflammation in the esophagus. So delayed would just mean that things cannot move through the GI tract. And there is another thing also called gastroparesis, and this is in the colon, where it can't move through food through. So people are having impaction of stool, etc., and it's very uncomfortable and leading to severe constipation and disorders. So these are some of the things that can happen when we see food. We want to just touch a little bit. I'm going to touch a little bit on the autoimmune GI disorders. And this is because Autoimmune is where you're attacking yourself. Some of these are genetic, and some of these are over time, probably can be attributed to these food allergies, things that have been going on in the body. But these are autoimmune conditions where the body starts attacking the organ or the system within you. Your own immune system is doing it. And you guys, some of you out there may be familiar with these because you have them, but we also hear a lot about these in the media now because autoimmune conditions are at an epidemic like level. More and more autoimmune conditions are popping up. And honestly, so many of the debilitating and not degenerative, but long-term conditions that we hear about, like Alzheimer's disease, Parkinson's, MS, Crohn's disease, celiac disease, these are all autoimmune. Rheumatoid arthritis, lupus, again, all autoimmune. So here's some GI conditions. Celiac disease, which is number one, and this is an autoimmune reaction triggered by ingesting gluten. All right, and you can Google gluten-containing grains and figure out what those are, but wheat would be the long one. That would be the big one, sorry. And the symptoms can range anywhere from like diarrhea, bloating, abdominal pain, to severe weight loss, severe malabsorption, colon hemorrhaging. This is how people back in the day, before they knew what this were, they were literally dying from this because they were bleeding to death, related to the compromise of the intestinal wall related to this. Celiac is, you can genetically test for it. Some people are just carriers. Some people have the full-blown condition. And there is also some called gluten intolerance, but it's not directly celiac disease. Celiac disease requires lifelong gluten-free diet. There's really no other treatment for it. Obviously cleaning up all your other food as well, but gluten is not your friend here. Crohn's disease would be a big one that we hear of when we talk about GI, and this would be grouped in the irritable bowel disease group. So Crohn's disease is inflammatory bowel disease, and it can go all the way from the mouth all the way to the anus. So it can affect any part of the GI tract. And symptoms include abdominal pain, diarrhea, sometimes with blood, fatigue, weight loss, malnutrition. And it can, in some areas, depending on where you have the severity of the condition, it can cause fistulas, strictures, and other complications that sometimes require surgery and can be very dangerous. And also, I do have some patients that have Crohn's disease, and it's so influenced by diet, but there's complications that can happen where you get these strictures or fistulas, etc. And even the dietary changes may not help the pain much. And so this can be a tricky condition to treat. Usually in the conventional medical model, they're using anti-inflammatory drugs, immunosuppressant, or biologics. And then obviously we're doing dietary management, and some people need surgery. The big thing though is food. These patients have to figure out the foods that they can and can't eat. Obviously highly processed foods, dairy, animal-based diets. Actually, Crohn's disease could do very good with animal-based diets, and we'll talk more about that. But Crohn's disease would be there. And then the other flip of the irritable bowel disease coin is ulcerative colitis. And this is another inflammatory bowel disease where you have chronic inflammation and lining of the colon and the rectum. And usually the symptom that you have with this is obviously abdominal cramping and pain, urgency to use the restroom, fatigue, and bloody diarrhea. Usually UC is going to be very frank red blood in the toilet, whereas Crohn's disease is going to be darker blood and or black blood. It's higher up in the GI tract, but UC is like real red blood in the toilet. Now, this can increase your risk of colon cancer and other inflammatory related conditions, which are likely more autoimmune conditions. And really the treatment is very similar to Crohn's disease. And again, a very hard one to treat, but I feel like I've had good success with this one with some of my patients with dietary management. and getting the food allergens out. Then we'll just kind of quickly go down the rest of this list. Autoimmune hepatitis is one. Cholangitis, which is autoimmune destruction of the bile duct, going into the liver. Sounds horrible, doesn't it? Can lead to cirrhosis and damage, liver damage. Primary sclerosing cholangitis, and this is scarring of the bile ducts. It's usually associated with those conditions like Crohn's disease and ulcerative colitis, and it can lead to liver failure. So the bile duct is, this is where we hear a lot of gallbladder surgeries. And gallbladder surgery's got to be on the top of the list of most done surgeries in the world. And the gallbladder is actually pretty important. It holds bile. It manages fat digestion. And so once people lose their gallbladder, there can be lots of GI issues that can happen as a result of that. But if it's a mess and there's this kind of stuff going on, it can actually lead to liver failure. Eosinophilic gastrointestinal disorders. So these are related to eosinophils, which are white blood cells, and they produce histamine, and they go into tissues, especially in the GI tract. We would likely see this in the esophagus. We'd see it in the stomach, other areas of the GI tract, and this can cause a ton of pain, hard time swallowing, nausea, vomiting, impaction, etc. And really treatment for this is dietary elimination, cleaning up those food allergens. Biologics can be used as well. And then corticosteroids, which we want to try to stay away from if we can, but they help bring the inflammation down. Microscopic colitis is one, autoimmune pancreatitis, gastroparesis. This is what I talked about before. So you have delayed gastric emptying of the stomach. And again, this would be autoimmune. And so autoimmune conditions are also increasing in our culture and in the last 50 years. And I thought it would be really interesting to go back and to do a little bit of comparison from like 1950, comparing gastrointestinal disease statistics from the 50s. And there has been a ton of medical advancement that's happened since the 50s when it comes to all forms of medicine. Like my mother's dad died of basically kidney failure, and he died a year or so before they had the dialysis machine. And so he may have lived a longer life or had time to get a new kidney had they had dialysis. So, things like this back then, we have come a long ways in some of these medical advancements. But I think it's important to, when we look at GI issues and death rates from GI, I think it's getting worse. And so in 1950, the death rate for specified gastrointestinal diseases was around 22 and a half people per 100,000 people. And in 1950, there's really limited data in general, because I think a lot of these disorders and diseases hadn't been discovered yet as far as like an official diagnosis and what they were. And so for things like irritable bowel disease, which would be Crohn's or ulcerative colitis, the data is limited, but it was in the data considered relatively rare. But if you fast forward to today, the prevalence of IBD has risen, with estimates indicating that 3.1 million adults in the US are affected by irritable bowel disease. This is not irritable bowel syndrome. This is irritable bowel disease. And irritable bowel syndrome was not really recognized or diagnosed in the 1950s either. But today it affects 6.1% of the United States population, with some estimates, depending on where you live, being as high as 10 to 15%. So maybe it wasn't diagnosed as much, you could say. Maybe there wasn't official diagnosis per se. However, we know based on our food supply that likely these statistics show such an increased prevalence because of our increased chemicals in our food, processing, and we're going to talk a little about some of those later. And basically the amount of, metabolic diseases and crud going on in our culture. And in terms of healthcare utilization, we talked a little bit about this in the beginning, but there's about 35.5 million visits to physicians with digestive system diseases, and about 8.4 million emergency department visits with digestive system diseases. And I've got a long list of numbers here, colorectal cancer, the numbers on that, pancreatic cancer, and we already went through a lot of this, but I just thought it was interesting when I pulled up some of those from the 1950s and I was just trying to find data. It seemed to be very rare, these conditions, compared to today where prevalence is very high. Okay, so now I've scared you and I've given you all these statistics and all these conditions that we see in healthcare that are very common when it comes to the GI tract. We've talked a little bit about food allergies and what symptoms you may have if you suspect food allergies. Now let's talk a little bit about just the function of the GI tract and what it does in your overall health. So I mentioned before, it's like the foundation. It's like the foundation of your house. It's doing, basically, it's connecting to every system in the body. So let's talk a little bit about the highlights of what the GI tract is doing, because I don't think people totally understand, because most people just eat and drink and they poop and they pee. They don't really know necessarily what is going on to make all that happen. Okay, so one of the first thing I want to talk about is in the GI tract, it's playing a vital role in nutrient absorption and energy production. So what's happening is it's breaking down food into essential nutrients such as carbohydrates. So you're taking carbohydrates, proteins, and fats in. It's breaking those down all the way down into glucose, amino acids, and fatty acids that then cross the intestinal lining, the small intestine. There are some things that cross the barrier in the stomach, alcohol being one. There's some vitamins and minerals that cross, but most of it is done in the small intestine. It also is breaking down things such as vitamins and minerals from our food. It's breaking all of this down, pulling it out, extracting it from the foods we're eating. Then it's absorbed in the bloodstream. Once it crosses the intestinal barrier, it's absorbed into the bloodstream. And this is what's providing energy, supporting growth, repair, maintenance of body functions, basically producing ATP, which is our energy currency that the mitochondria in our cells make. Another function that the GI tract doing is immune system support. So we talked about the autoimmune conditions and why the gut is so heavily influenced by the immune system. The gut is home to 70 to 80% of the immune system. And there's this thing called gut-associated lymphoid tissue, or GALT, and the microbiome. These are working together to protect you against harmful pathogens like bacteria and viruses and maintain a balanced immune response throughout your body. 70 to 80% here. So this is why a healthy gut equals a healthy immune system. Microbiome diversity and metabolic health. Now, the GI tract houses trillions of beneficial microbes that aid in digestion. These microbes produce vitamins, they regulate your metabolism, and so a healthy microbiome is associated with a decreased risk of chronic diseases. And also a healthy microbiome, these chronic diseases like obesity, diabetes, and other inflammatory conditions. Again, it can start in the microbiome, and we're going to talk more about the microbiome specifically in this series. Another thing is the brain-gut axis and mental health. So why do you eat something and then get a headache? Why do you eat something and then you get anxious or depressed? The gut and the brain communicate, and they communicate through this big nerve, cranial nerve, called the vagus nerve, and also through neurotransmitters like serotonin. And this connection influences your mood, it influences stress levels, cognitive function, and it really emphasizes the gut's impact on mental health and neurological well-being. So again, if you're ridden with food allergies, you could be having mental health issues, and it could be from what you're ingesting. Obviously, detoxification and waste elimination. The GI tract plays a crucial role in eliminating toxins and waste through the liver and the colon. And this process really ensures the proper excretion of harmful substances, that we take in, and it does support liver function, aiding in detoxification. Now, we are detoxification machines. We are built to detoxify. That's why we have a liver. That's why we have kidneys. That's why our skin is the way it is. We are meant to detoxify. And we're going to get a little bit more into phase 1 and phase 2 detoxification when we talk about the gut this week, but very important, obviously. And so this gives you a little bit of a summary of the things that the GI tract is responsible for. It's not just digestion. People think digestion is actually breaking stuff down, which yes, you need like good hydrochloric acid to break down proteins into peptides, but you also need pancreatic enzymes in the small intestine to break those peptides into amino acids, right? And then you absorb that through the GI lining. So detoxification and absorption are different functions. And then once you get to the liver, which we're going to talk more about, you're talking about detoxification, cleaning up the stuff that's coming in, and how the immune system is regulating this and taking note of this. And then obviously elimination and having what you don't want coming out the other end. And at the other end, we've got the microbiome, and what the microbiome's getting fed and how well it's functioning is going to dictate all the way down to our hormones. Did you know there's a part of your microbiome called the estrobolome women, and estrogen plays into it? So your microbiome changes during menopause. And so again, the gut-brain axis is influencing all of these things. We talked a little bit about conditions, probably the conditions that people come in and see, but I think related to what I just talked about what the GI is doing for you and how it's doing its job, the big things that people usually come into the doctor for, that aren't as severe as things I talked about in the beginning, GERD, acid reflux, that's a huge one. And this is definitely influenced by lifestyle. Irritable bowel syndrome, which is basically alternating constipation, diarrhea, abdominal pain. They really don't know what causes it. There tends to be no blood. If there's a biopsy, there's no irritable bowel disease like Crohn's or ulcerative. So like choices and food and allergies and stress can play into IBS big time. Another one is ulcers. So this would be part of that gastritis, but ulcers would be pain in the stomach or pain in duodenum. There's 2 types of ulcers, and these do damage, big time damage. And these are usually caused by people doing either you have H. pylori, which we talked about earlier, or a long-term use of NSAIDs, which would be like ibuprofen, aspirin, lots alcohol will do it. High stress will also lead to ulcers. And then inflammatory bowel disease we've covered with Crohn's and that. And then constipation is a huge one. Obviously, I see this more in women than in men, but constipation is a huge complaint when people come to the doctor usually. And there can be conditions like a slow thyroid that could be leading to that. Dehydration is a big one. I mean, we live in the high and dry here in Montana. People don't realize how dehydrated they are. And so they can get constipated just from dehydration, not moving enough, not exercising, medications. You've always got to think about medications people are on when it comes to symptoms like this. And just maybe, fiber is what we've prescribed a lot in the healthcare community. Some people would, now that we've kind of been on this animal-based journey, some people would counteract that. But the big thing with constipation is it can lead to things like hemorrhoids and fissures and problems like that. So, getting constipation under control is really important for most people. Now, I wanted to jump from the GI tract, the conditions, food allergies, why are people going to the doctor, and then what the GI is doing for you. And I want to go into the external world a little bit, and I want to talk about significant ways that nutritional quality is affecting our health outcomes, okay? And especially in the United States. And this is because when it comes to food, most people are buying their food in a grocery store. They're buying it from somebody else who farmed it, who processed it, who put it in the packaging, who shipped it. That's how they're getting their food. Okay. Now, depending on where you live and who you are, if you're in this community, hopefully you're getting wild game and you're getting some meat of your own. Maybe you're growing a garden if you're eating vegetables, etc., and you are creating more of your food supply. That's something Ryan and I have literally always talked about, and we're huge proponents of. But most people are not, and they're relying on conventional agriculture to get them their food. And so I wanted to talk a little bit about how the outside external world is likely influencing our internal world. So let's talk a little bit about agricultural practices in the United States. The United States relies heavily on pesticides, herbicides and pesticides. Pesticides like glyphosate, are used more extensively in the United States than in any other Western nation. And these can lead to higher pesticide residues in foods, which we know can cause long-term health risks. Now, consider that you're eating these foods and they're going through the digestive process. How can, the type of food you're eating and what's on that food and what's sprayed onto that food is obviously going to have a huge influence on your GI tract. Genetically modified organisms, so these are known as GMOs. Now, in naturopathic medicine, we have been talking about GMOs for literally decades. We were concerned about these in the early 2000s when I started my nutritional program. And today, it seems like GMOs are more rampant than ever, but we're starting, again, going back to autoimmune conditions and all these GI conditions. How are these affecting us, and how are they affecting our GI health? Now, crops like corn and soybeans, they are highly genetically modified in the United States. In many European countries, they have really strict regulations or bans on GMOs. I worked in Turkey for a bit of time. It is illegal to grow a GMO seed in Turkey. The food there, the bread there, the grains there are completely different than here. I can attest to that from being there. If anybody's traveled to Europe or any place else where there's more strict regulations, the food is different. You feel different when you eat that food. So these are some things to think about. And these genetically modified foods, sometimes, yes, they keep bugs off, but they might also require more chemical herbicides. So that's another thing to think about. Food additives and chemicals. This is another big one. So differences in food additive approval. Now, the U.S. permits additives like artificial colors and preservatives that are literally restricted in the European Union and in many other parts of the world. I mean, this can be concerning due to the links with behavioral issues in children and potential health risks. And I'm gonna talk a little bit more about that in a second when I come to some research that's recently come out. Another area here is hormones and antibiotics in animal agriculture. So we've all seen the big farms where animals are caged, penned, fed drugs, fed Skittles, whatever. And hopefully, if you're listening to this podcast, you've made changes to change that. If you are eating beef, poultry, or pork, that's really important. But in the United States, the use of growth hormones and antibiotics is unlike anything in the rest of the world. And it can lead to residues in the meat and the dairy products and can cause all kinds of possible health implications. Why are so many people allergic to milk? Milk is a whole food. Well, we do a lot of processing of milk. Also, when you have hormones that could be doing it as well. And with the average age now of 9 years old, a girl is going into puberty and she's starting her periods. Hormonal changes are starting earlier and earlier related to these hormones. All right, another big area here is the processed and ultra-processed food system. The U.S. diet heavily includes ultra-processed foods, which we talked about. Up to 60% of our diets are processed foods. And these are just additive, unhealthy ingredients, and they're contributing to the epidemic of obesity and diabetes, heart disease. And this could even come down to this whole debate over cholesterol and heart disease. Processed foods. Cardiovascular disease is very low in the 50s. Let's go back to that. Today, it's the number one killer. What's changed? We have less cholesterol in our diets than we used to. We eat more seed oils. We eat more processed food. That's all seed oils are. Seed oils are a processed, heavily processed food to the point of ad nauseum. And 20 years ago, naturopaths and nutritionists where I was trained were talking out against these oils. Don't use canola oil. It's horrible for you. So you can see that a lot of the things that actually get to clinical, we've been talking about this in medicine for a long time, but it can take 10 to 20 years to get into clinical application. And we have a lot to owe to the internet, to doctors who are stepping out of their comfort zone and changing the way everybody, not just the little hubs of alternative people like I was in for most of my life, like everybody's seeing that we're being poisoned basically by our foods. All right, another big one is nutritional quality. So the U.S. fortifies food to address nutrient deficiencies. So they're taking a whole grain, they're breaking it down into, they're taking the germ off and whatever, then you have white bread, then they've got to refortify it. So they refortify cereal, they refortify pasta, they refortify bread. And basically what this can do is you're taking nutrients out and then you're putting them back in, but this can cause people to be overeating. And it can also cause overconsumption of certain nutrients, causes deficiency of certain nutrients. And it's a big problem, nutritional quality, obviously. And I think, back to processed foods, like nutritional quality is going to be crap. So, they've got to fortify it and make it look healthy for us. Otherwise, why do we think it's important to eat? But all right. And then food safety regulations. The U.S. regulatory standards are often less strict than those in the European Union, and this is resulting in the presence of more harmful substances in our food supply, which we're going to talk about in a minute. Environmental sustainability. So industrial farming practices in the U.S. are really degrading. Mass farming is doing a lot of degradation of the environment. Unlike regenerative practices, which have been adopted in more Western European countries, are being adopted by farmers and ranchers in the United States more and more because our soil is everything. If the soil is not good, we die. That's so vital. And it's hard to get that through to people that are just buying their food in a grocery store. And that's because you don't have any connection to the soil. You don't understand. But try to go out in your yard and just grow a garden if you have horrible soil. You'll see what happens. You'll waste all your money. You'll lose all your seeds. Nothing will grow, right? You need the right light. You need the right water. You need the microbiome in the soil. You need all those critters in there. You need all the nutrients and the three big essential, macronutrients that plants need. You need that. So if you have poor soil, you have to be putting chemicals on there, et cetera, et cetera. And our farming practices in the United States are on top of the list of poor farming practices for our overall health. Now, the U.S. also sees higher rates of diet-related diseases like obesity, diabetes, compared to other even Western countries. Now, they say it's changing and that kind of thing, but I can tell you, I've been to other countries, westernized countries, where their food is amazing. It's not heavily processed. People are not as overweight as they are in the United States. And I will say right now, it's not 100% the person's fault who's overweight. They're eating over 60% of their diet non-processed foods. They're being advertised to. They're being lied to. From the moment they start consuming their foods, they're becoming addicted to these foods. It's changing their microbiome. It's changing their neurochemistry in their brain, and they're gaining weight. And then they can't figure out how to lose weight. So this comes to the whole conversation of Ozempic and weight loss drugs and all these kinds of things. We really need to heal our food system. That's what we need to do. That's like vital. And without that, we're going to continue to see this rise of chronic disease and obesity and all these things that in a lot of cases, most people from the time they're born and they grow up, this is how they're eating. And it can be huge to change this, but I see it coming. I feel like there's some positive movement happening that can be changing some of these. So really, in conclusion, the U.S. food supply prioritizes convenience. It prioritizes cost efficiency, while many other Western countries prioritize sustainability, safety, whole foods. And these disparities have significant implications for public health, the environment, and the choices the consumer has, like in food deserts, places where there's only fast food and etc. So we've got a long way to go in the US. And I think that we have this idea that we rise above everybody else and we're great. We're just not seeing that statistically when it comes to things like this. So I mentioned I was going to talk a little bit about some new research that's been coming up related to food additives. Thumbs up. I like how that works. That's right. How it comes to food additives. So just recently, there was some legislation, and we know that a month or 2 months ago, I don't remember the exact date, a bunch of people went to Washington, D.C. to debate the food issue and the food industry. And of course, in the mainstream media, everybody was called a wacko, a wackadoodle. And again, I've been called a wacko for over 30 years because of the profession I'm in. So I'm used to that. Naturopaths are used to that. We've been called wackos forever. But when you have mainstream medical doctors going and talking about how they are seeing so much dysfunction in their patients and we need to change the food supply, this is revolutionary. And for the mainstream media to be telling people that this is wackadoodle, you can see who's buying them, who owns them, who owns the media. So let's just chat a little bit about food dyes. And I like this because, again, from the outside in. Now, food dyes are basically banned in most parts of the world. Okay. And when you think of a food dye, just think of like some bright colored candy your kid wants to eat. Okay. Blue, red, yellow. Most of these are not natural. Obviously, you've seen those blues. You're like, there's nothing that naturally makes that blue anywhere. So these artificial dyes, so you've got red 40, yellow 5, yellow 6, blue 1. They've been linked to so many health issues. These come from petroleum. That's where artificial colors come from. And if we're going to talk about any population that's being most impacted by food dyes, let's talk about children. Studies show that red 40 and yellow 5 can exacerbate symptoms of attention deficit hyperactivity disorder and contribute to hyperactivity in children. In fact, The Lancet published a study in 2007, that was like almost 10 years ago, highlighting the effects of certain food colorings and preservatives on children's behavior. And food dyes can trigger allergic reactions, which we talked about before, sensitivities leading to rashes, hives, respiratory issues, especially in sensitive individuals. And what is the big reason people go to the doctor? Remember, skin issues and respiratory issues. Yellow number 5, also known as tartrazine, has been associated with asthma exacerbation and skin problems, while red 40 may cause hives and gastrointestinal distress. So other food dyes, including red 3, they've been classified as a possible carcinogen. Red 3 has been linked to thyroid tumors in animals. This is obviously raising concerns about its safety, and we're feeding it to our children and to ourselves. And these dyes can interfere possibly with hormone function, disrupt the endocrine system, alter the gut microbiome, and potentially contribute to systemic health issues. And obviously the connection most of the foods that contain food dyes are ultra processed and nutrient poor. And so this is continuing to lead to an unhealthy dietary pattern and association again with obesity, diabetes, and diseases of all kind. And I mean, honestly, if you have kids and you've seen them eat candy with all these colorings in them, you know what happens. Mood swings, irritability, cognitive, brain fog, fatigue, neurotoxic effects. They're freaking out. These can be big ones. So the European Union has mandated warning labels on foods containing certain artificial dyes, and they phased out the use of a lot of these. Canada's done it. Countries all around the world have done it. Now, in contrast, the US, the FDA, permits the use of many of these artificial dyes, but requires periodic safety reviews, despite known risks that things like red number 3 are carcinogenic. Right? We'll just keep studying. We'll keep doing studies and spending taxpayer dollars or whatever to determine whether or not these things cause cancer when we already know that they do. And so, obviously, when you have products and you're creating products, the goal is that you would be using better things. If you had a candy, you want it to be colored, right? You're going to want to mitigate risk. And so a lot of food manufacturers now are opting for natural coloring agents. They're using turmeric, beet juice, spirulina, paprika, and they're transitioning to natural alternatives. So transitioning to natural alternatives or reducing processed food in general is really going to reduce your exposure to artificial dyes and potential health risks. Now, recently, I think it was last week, the FDA just announced that they are going to possibly remove some of these dyes from food. And the only reason they're doing it is because all the wackos that went to Washington, D.C. put the pressure on. And that means all the mothers out there, all the fathers out there, all the doctors and the people that realize that we are poisoning our children and poisoning our population while the rest of the world is not. And they're looking at the United States saying, what are you guys doing? Or how about we send all our cancer-causing chemicals to the United States? People are standing up and saying no. So the FDA is getting a clue, and possibly they're going to be banning these artificial ingredients, which is going to be a huge hit to the processed food industry. I mean, imagine if you have a candy company and you've been using red number 3 and yellow number 5, etc. It's a big change, and it's going to be much more expensive for you to create those candies, but it can be done. All right. The last thing I want to finish on, if we're talking about just going off on my rant, and I don't rant that often, but I've been in the nutrition and the health field for 30 years, and I've seen trends come and go, and I've seen all these things, about diets and ways in which we can alter ourselves in order to somehow be able to continue down the path that we are. But what I realize and what I see, and 20 years ago, we were talking about these dyes, these food chemicals, these processed foods. We're trying to teach people how to eat whole foods. Is that there's really no way around simplicity. And if you want to be healthy, really, truly healthy, you have to get educated. And hopefully that's why you're listening to this podcast and I'm ranting right now. I'm not lecturing you. I hope that you understand I have your utmost health in mind. And I want people to just make better educated choices because we have the education today. There is no lack of education, which means there's no excuses. However, I also understand that there's lots of different people in the United States, lots of socioeconomic differences, racial differences. And we do know that, unfortunately, a lot of people that are heavily affected by these things like artificial food and pesticides and herbicides and runoff from these large farms with hormones and chemicals are underserved populations. And that's something that we all should be working towards helping. And obviously, socioeconomic class. We should not just be providing cheap processed foods to people with less financial means. We should have the ability for all people to have access to fresh, whole food. When I worked in Russia, they had a market. It was down the street. Everybody went to the market every day. It was fruits, vegetables, spices, meats, cheeses, crafts, whatever. With every food under the sun right there. And you could buy piece by piece. And it was not just meant for rich people. Everybody shopped there. Everybody was going there. And in Russia, people were not rich. The place I was in, people were not rich, but they knew how to eat. They knew how to cook. They knew how to shop, and they could go there and they could afford fresh, whole foods right there in their local community. And I think that's really what our whole mission has been about, is bringing you back to simple and teaching everybody the power that they have, and hopefully start demanding more from their local grocery stores and where they shop, etc. But anyways, okay, so my last rant is about glyphosate. Now, glyphosate is created by Monsanto. It's one of the ingredients in Roundup, okay? And it's the active ingredient in many, many herbicides. And it's been extensively studied for its potential side effects in gastrointestinal health and on the GI tract. And interestingly enough, research indicates that glyphosate can disrupt the gut microbiome, and it can impair digestive processes and can compromise the integrity of the gut lining. Go figure. What do we have so much of in this culture? Compromised integrity of the gut lining. This is where a lot of this starts, okay? So let's talk a little bit about the impact on the microbiota. So glyphosate functions by inhibiting enzyme, which has a very long, complicated biochemical name. It's called EPSPS, and it's in the shikimate pathway. And this is a route present in plants and many microorganisms, but absent in humans. However, this pathway's presence in gut bacteria, so our gut bacteria have this, but our gut bacteria have this, and it makes us susceptible to glyphosate because of that. So studies have shown that glyphosate exposure can alter the composition of your gut microbes because of this pathway that is similar to what plants have. It causes a reduction in beneficial bacteria. So the research also indicates that lactobacilli and bifidobacterium species, these are particularly sensitive to glyphosate, and they're leading them to a diminished presence in the gut. And this can disrupt normal gut function and immune responses. Then this can cause overgrowth of pathogenic bacteria. And what you get is this suppression of beneficial bacteria allows for the proliferation in harmful species such as Clostridium, bacteriocytes. You can see overgrowth of Candida, and this can increase the risk of infections and inflammatory conditions. And then besides the microbiota, glyphosate also alters the gut environment itself, and it has shown to increase the gut pH. Now you need a low pH in your gut, especially in your stomach. That acid has to break stuff down. It has to kill viruses and bacteria. It has to break down your proteins. You need a low pH in your stomach. And the glyphosate can increase the gut pH, and this can create conditions that favor, again, the growth of bacteria because you can't kill it. It disrupts the mucus barrier, and the gut's mucus layer is very rich in what are called sulfated mucins, and this is a protective barrier. And glyphosate impairs the sulfation process, and it compromises the mucus layer integrity. So it makes the gut lining more susceptible to damage and inflammation. And then it causes gut barrier integrity issues because the epithelial cells that line the GI tract, they form that barrier that regulates the passage of things across the barrier. So glyphosate can expose the barrier, which causes increased intestinal permeability. And this is what we call leaky gut. Now, 20 years ago, when I was in medical school, leaky gut was something we talked about all the time. However, the conventional medical model poo-pooed it. They said it was crazy. It doesn't exist. You guys are making this up. This is just all those alternative wackos making this up. Now, conventional medical model talks about leaky gut, increased intestinal permeability issues. So like I said, guys, it takes some time, but some of us have been talking about this a very long time. And when you have leaky gut, you can get undigested food particles, large proteins, toxins, bacteria, etc., all this stuff that can trigger systemic inflammation and an autoimmune response. And what do we have so much of in this culture? Autoimmune disease, especially in the gut. So what are the human implications of glyphosate? What are the implications on our health, I guess I should say? Alterations in nutrient absorption, immune system impact, weakened immune responses, susceptibility to infections and diseases. And what does that lead to? Chronic disease, autoimmune disease, chronic pain, skin disorders, mental health disorders, and eventual death. So really, glyphosate is something that's been used for decades now, and maybe one of the biggest reasons in our food system that we are seeing so much GI compromise. All right. Well, I think I've over inundated you with lots of information about GI disease, how the gut works, some of the outside environmental factors that could be playing into food allergies and gut issues in general. The next 4 episodes are going to be about the 4R system, or the gut restoration program that I've used with thousands of patients now. And I'm going to break it down, and I'm going to help you understand how you can use each part to repair, restore, re-inoculate your gut, help you feel better. Maybe also just when you feel better, you want to make healthier decisions. And so you want to make better food choices. And that's really what it comes down to. Eating is something that you're going to do almost every day of your life, if you can. And so the type of food that you choose, the source of the food is really important. And I know this podcast could be somewhat discouraging, and a lot of us are probably thinking, oh my gosh, where do I start? And how do I cut out processed foods out of my diet? As an American, it's very hard to do, and I can attest to that. And I have kids, and I can attest that it's very difficult to do. But you can make small strides just by choosing whole foods, organic foods. This is not woo-woo. Organic doesn't have glyphosate. Organic doesn't have hormones. Organic doesn't have pesticides and herbicides. And there's no GMOs. So this is why organic is so important these days. All right. Well, I hope you guys got something out of that. You might need to listen to it over a little bit of time. There's a lot of information in here, but I look forward to sharing the rest of this GI health series with you. Again, subscribe to our channel here on YouTube. Go follow us on Instagram, and you can also visit our website at stealthyhunter.com. See you later. Because I am a doctor, and I'm probably not your doctor, this is just a disclaimer. So anything here at Stealthy Hunter, Hunt Harvest Health, or Stealthy Nutrition is not used to prescribe, treat, or diagnose. And any of this information that you take from this podcast, from our website, or any other source related to Stealthy Hunter is for informational purposes only, and you use at your own risk.